everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. There we are. Hi, everybody from the Vascular Birthmarks Foundation. It's April 2023, and I'm very excited to be here in Boston live with our very own VBF Italy director and VBF medical on our medical editing board, Dr. Giacomo Colletti. So welcome.
Welcome to you all. Thank you, Linda. It's always a pleasure, an honor to be here with you. It's good to be in Boston. We just got out from the ISFA meeting, so a lot of good new informations that we are all wanting to share with you.
And we are going to take any questions as soon as you want. I see 6 of you are on. So remember today, tell us where you're from, what part of the world, and ask your questions. And even if you're just going to say hi, because now I see there's 8 of you on, say hi, tell us where you're from. I'm not seeing any comments. So if you want to just throw a comment on so that I know that that's working. I see Scott Couples is watching.
Hi, Eva.
Alexander says hi, and Ava, thank you. There we go. And Scott's saying hi. So there we go. So I see that everybody's logging in. Hi from Georgia, the country of Georgia. Well, if you can come to our free clinic in December 1st, we're in Italy. So anyways, we just came from this international meeting on vascular birthmarks and vascular anomalies. You and I were both there learning, listening. We agreed with most things. Some things we didn't. We learned some new techniques, but
I believe we agreed on most things. On the other hand, for sure, we need to be into research because there are several fields that are not fully covered yet, so the research projects are of the uttermost importance, and we are very happy to be contributing to that with our own research. And at the moment, our personal research is focused on AVMs, treating them with interstitial ultrasound-guided bleomycin, and in certain instances even electrosclerotherapy. It's a technique developed years ago, but we made a few changes to it in order to make it effective in AVMs, and preliminary results are quite encouraging. What do you say?
Oh, I mean, it's up to you, but I think you should give people hope and just say, is okay? That one of the patients has had 70 procedures prior to going to Dr. Colletti with the extracranial AVM, so not intracranial, although she does have some intracranially, right?
Yeah.
But tough case, one of your toughest ever.
Yeah. And
you did 1 electrosclerotherapy on her in February.
Yes.
And the part that you treated, what did you see on ultrasound today?
Well, it was amazing because the area that we treated with this new technique method, there was no signs, clinical and instrumental with the ultrasound, of residual disease, which is something that unluckily you don't see very often in AVMs. So it looks like it's a very effective means of treating, hopefully curing, but treating, I have to say for now, complex and otherwise disfiguring AVMs.
And that wasn't just the only one. There was another person who came who had never had her AVM treated, and it's pretty pronounced. It's pronounced but localized.
Yeah.
You did 1 treatment on her, two, and disease is gone. So you can now begin reconstruction. So we can safely say a year from now, this is all in her past.
Correct.
And that's something that AVM, extracranial, facial, major facial, lip, parents of children with AVMs, they've never been given this hope. they've been told, oh, you're going to have all this sclerotherapy and embolizations and coils and glues.
Yeah.
But this new procedure is a game changer. It's April of 2024. People are going to go back and reference this video as to when this all began. And I'm so excited about it. So we have a question from Scott. He said, one thing you've demonstrated is the ability to leverage ultrasound to evaluate a port wine.
Yeah.
Can you explain how it helps you diagnose and treat a birthmark?
So the fact with port wine stains is that the vessels that are behind it are usually very small. However, we routinely do ultrasound in port wine birthmarks as well, and by doing so we were able to find that those areas where hypertrophy is or is going to be will show a higher density and size of vessels. So this allows us to somehow predict the course of the disease and to try and prevent hypertrophy with some procedures.
That's great, and I think to follow that up a little bit, there's been all this controversy since we posted that some port wines aren't, but they have an underlying AVM.
Yeah.
And that's the most critical thing, because somebody starts hacking at that AVM,
Yeah.
or they keep pounding that port wine with a laser, then you're going to end up with a monster.
Yeah, the fact is that some AVMs early on may show signs in the skin that are overlapping definitely with a port wine stain. So the fact is that if you do laser or other procedures that will cause some ischemia on those tissues, this will trigger an abrupt increase in the growth rate of that AVM. So this should be avoided at all costs, and you can differentiate a port wine stain from an AVM with just a very quick ultrasound imaging. So I believe that in many cases it should have been done.
And to date, since you've been working with me since 2018, but we only started the ultrasounds in 2019,
Yeah.
I calculated that we've done about 400 ultrasounds with your clinics, our clinics, and I would say at least 1%, which would be 4, somewhere between 1 and 7%, you've reversed the diagnosis because they were inaccurate.
Oh, definitely.
And that definitely, I mean, we saw it in Boston, we've seen it in New York, we've seen it, patients come in and say, oh, I have an AVM, and you're like, no, it's just a venous malformation.
Yeah.
Or vice versa.
That is true. And in my hands, for instance, if I have a doubt, a diagnosis between a hemangioma or a vascular malformation, the ultrasound is, in fact, even better than an MRI. I put my probe on the lesion, and I can tell if it's a hemangioma. And if it is an hemangioma, I am usually able to tell in what phase, meaning proliferative, stationary, or involuting. That is the power of ultrasound.
So we have a good question from Alexandra. Her baby has a port wine. He's 18 days old, and they're deciding between the V-beam perfecta or the Prima. Now, let me just say this. There aren't many Primas out there. In my opinion, the top who makes the Prima the best is Dr. Roy Geronimus. I don't know who you're using, so I don't know, but if I could get you to Roy Geronimus, I would say he's the best choice. But I don't know who your doctor is, because if he's not super experienced, though you say he is, I don't know what the results are. So you could get a test done, right? Maybe a test spot with the Prima and Perfecta. I don't know. What do you say? A baby's 18 days old.
I prefer to just say that I would use a Perfecta now. I don't think that times are ready for the Prima to be the standard machine.
Okay, that's good enough. Jennifer Gee, I don't know this, so I hope it's something you know, because you know a lot more than me. is can you talk about the medication V-Joyce, V-I-J-O-I-C-E?
Rejoice, I don't know that because this must be the commercial name. If you could tell me the name of the active principle, then I can discuss it.
Right, like if it's alpelisib
Yeah.
or sirolimus.
It's probably alpelisib,
Yeah, that.
but I have to know that for
Yeah,
sure.
you have to explain that. Tiffany wants to know what is an AVM. Good question, because
Good.
we're talking about it.
Yeah, and AVM is an arteriovenous malformation, which is the toughest of all vascular anomalies. It is caused by a aberrant vascular structure in that area where an artery directly connects with a vein, creating this direct connection, which we call shunt or fistula. The issue with the fistula is that it will grow in time and with time, and it will paradoxically steal blood from the tissues, which will slowly but steadily suffer. So with time, what you observe is the AVM becoming bigger and bigger, and then complications occur like ulceration, infection, pain, brutal hemorrhages at time. It's a very difficult, tough disease to take care of, especially because if an AVM is improperly treated, for instance, partial resections, many other ischemic agents, the AVM will recur, and recurrences are always worse than the original disease. So those are very delicate diseases to manage.
So, quick shout out. So, it used to be Dr. Moija Lapidot in Tel Aviv that was doing these lasers, and he has the old pulse dye, which is standard, gold standard. I don't know this Dr. Friedman. I know our Dr. Paul Friedman, and I know that there are not many pulse primas. The only one I would trust in the U.S. on doing a baby is Dr. Roy Geronimus. Even my top doctors, like Dr. Nelson, will not use it because it has some irregularities in it. And for me, that's too risky with the baby. If you had a giant port wine and you want to test half of it with Prima and half of it Perfecta, then do it, but not on a new baby. You're safest with doing a Perfecta.
I still prefer the Perfecta. Let's put it like this.
Right. So, so the woman that talked about that V-Joyce, she said it helps a PIK3CA mutation.
Yeah,
so that's
it's alpelisib.
That's Novartis's alpelisib.
So alpelisib is a drug which was originally conceived and produced as a chemotherapy drug, because PIK3CA mutations, which are commonly the cause for, say, lymphatic and other malformations, is a shared mutation with some kind of cancer. Beware, this doesn't mean that vascular malformations are cancers, nor that you have an increased risk of cancer if you have a PIK3 mutation. This has to be clear. But if a malformation carries that mutation, then alpelisib can selectively inhibit an hyperactivated PIK3CA and be, in selected cases, an effective drug. So let me be clear about this. There is a lot of justified hype regarding medications for vascular anomalies, but you have to take into consideration that these drugs have potential side effects. So they are very helpful. I use them, I prescribe them, but it is not the first line treatment. It has to be used mainly for wide, vast, complex malformations where usual treatments such as sclerotherapy, laser, or surgery is not feasible or not enough.
Okay. We have a lot of questions coming in. What is your advice on treating a port wine stain on the gums?
That is debated. That is highly debated. So when you say gum, you should be more precise. When we're talking about the gum you see, then that can be lasered. you have to use very, very gentle parameters because otherwise you risk necrotizing the gum. And the other thing is the periodontal disease that frequently happens in port wine stains of the maxilla or mandible. And then again, the periodontal disease can be treated with laser, but it is not a pulse dye laser.
And if you could, we have our conference in October in New York City, and Dr. Darrow's there, who's the leading dentist, and he can do a free dental exam. The doctors with all the lasers then could say if he was a candidate or not for maybe a gentle YAG or whatever. But you really need to be seen, and at our conference we do free lodging for one night, and you have all of these services, Dr. Colletti. So I highly recommend you sign up at birthmark.org for New York City. Okay, so the other one was, so I told you that it was diagnosed with the CMVA was the MAP2K1 mutation, and they have very little information on it.
Say that again, sorry.
The baby that was diagnosed with a CM-AVM with a MAP2K1 mutation. We can get very little information.
Okay, so
point us in any direction.
If the baby has a MAP2K1 mutation, that is very unlikely to be a CM-AVM because the mutations on CM-AVM are mostly RASA, while MAP2K1 is a typical mutation of common, let's call them common, arteriovenous malformations. And so if they found out that this is the mutation the patient carries, then we have specific drugs inhibiting hyperactivated MEK or MAP2K1. The most commonly used one is called trametinib and is showing promising results, but then again, drugs should not be considered, in my opinion, the first line treatment for vascular anomalies in general.
Right, and again, all the top docs are going to be at our free conference. So if you're not in a hurry to start anything, you could come, and we have a whole multidisciplinary group to speak about that. Is topical sirolimus in use in the U.S.? Yes, I can answer that. You can talk about it if you want.
Yes, it is used. You can also have your pharmacist make it as a gel or a cream for you. But we have to discuss what you would like to use topical sirolimus for, because there are specific indications where topical could work and others where it would be absolutely pointless to use it. For instance, if you have a localized lymphatic malformation or what someone calls lymphangioma circumscriptum,
that would be me.
Which I don't like, to be honest with you. Then yes, in that case, topical sirolimus plays a role. It can be very effective. In other lymphatic malformations, as far as the surface is concerned, then again, it can be effective, but this is not the case for major, especially for deeper components.
Why don't you like the term lymphangioma circumscriptum?
Because there is a problem with the semantics here. So Hooper was a scientist who in 1828 stated that in medicine everything that ends with the suffix "oma" should be a tumor. So if you say lymphangioma, you imply that there is a tumor, or hemangioma cavernosum.
Is that it, the reason? That's it? Because it implies it's a tumor.
Yeah.
So we just change it to lympho-circumscriptum.
Localized cutaneous lymphatic malformation.
Okay. with localization.
Yeah.
All right, well, I'll get right on that. Jeff Bergen is saying hi to
Hi,
us.
Jeff.
Come on, Jeff.
We're waiting for
we got
you.
all of our peeps scheduling the last week of November to the first week of December. So get on it. Get your plans made to come to Italy with us.
And thank you for taking me to the airport in
Oh,
Los
yeah.
Angeles.
That
It was
so
a very
sweet.
beautiful.
Yeah, he's great. Rachel says, what is the drug called that you're talking about? I didn't hear the name.
Alpelisib.
And Novartis. If you look up Novartis, Novar, which is a massive drug company in the U.S., and you look what they're doing for PROS, PIK3CA related overgrowth syndrome, you'll see the Alpelisib, clinical trials, lots of info. Again, you
I
can
think
email
that
me.
the original name was BYL719, if I'm not wrong.
You're probably right. Any questions from any of you, too, you could just email me at vbfpresident@gmail.com. I can always forward it to Dr. Colletti or get more research for you to get the info back to you. All right, Mars is saying, I just had an MRI done and they found a birthmark on my liver that may be related to Sturge-Weber. Are there any treatments for this, or is something that I should be monitored? I have not heard.
No.
information on Sturge.
So Sturge-Weber is a syndrome where the underlying cause is a capillary malformation, or we should say venular malformation, because the defect, even in capillary malformation, does not lie in the proper capillary bed, but in the first post-capillary venules. And this has no correlation with lesions on the liver. So I hardly believe that what you have on your liver is something related to your, I suppose, Sturge-Weber's.
Yeah, it's funny because when we were talking about like autopsies, the things they find, and they were saying like there's a lot of people that have liver lesions throughout their lives, and they all contact me and say, my doctor said I have a liver hemangioma. I'm like, Dad, just let it go.
No, listen, this is something very important indeed. So you frequently have to deal with colleagues, especially radiologists, who will talk about liver hemangioma or spine hemangioma. Those are not hemangiomas.
Oh, yeah?
Those are venous malformations. And a simple single venous malformation in the liver has no meaning. It's okay, leave it there.
Yeah, they can all leave it there, and that's the thing I tell people when they, especially adults, are like, oh, I went in for bad back and they found this, and now do I start a beta blocker? And I'm like, no, just let it go, right?
Because those are not hemangiomas.
Right.
Because everything that ends with the suffix
I know.
-oma should be a tumor.
Right.
And those are malformations.
Right. So this is a question that I've had some info on, and I don't know if you've had. It comes from Sabrina. She wants to know if KTS patients have increased chance to get breast cancer because they have the PIK3CA. I just want you to know we are collecting this information because we do have what appears to me to be either large or it's coincidence number that write to me and say, I have KTS, I was just diagnosed with breast cancer, and they're saying they're both a PIK3CA.
Okay, so the answer actually is easy. KTS is a clinical condition which is frequently caused by a somatic mutation in PIK3CA. What does somatic mean? It means that the mutation is only and only in those tissues where you have the disease. The rest of your body does not carry that mutation. So there is no linkage between KTS and breast cancer. The mutation one could find in another area. If it's not germline or constitutional, we say, it's not linked.
Thank you. Do you have your glasses? Because this is written in Spanish. I can read it to you, or you can read it. Because I know at least you can read and understand it. He's reading a question in Spanish. Stay tuned. Sorry, I can't. I guess you'll have to, you might have to answer her in Spanish.
Sí, María, creo que entender que tú estabas en California con tu niño, en Irvine, pero no entiendo la pregunta. No hay pregunta aquí.
And what was the question?
We don't have the question. She
Oh.
says, she says they were in Irvine for the last conference.
Oh, okay, yes.
But she didn't really do a question.
Okay, they may be the family that came from Honduras that had, and
I
we
don't
had. So if you can get your question in English
No, that you
or
can, you can
Spanish,
you can do it in
and
Spanish,
they can
but
send it to you or
what's your question?
repost it. Yeah, we need to know what the question is. So Jennifer said, well, how do I get an accurate diagnosis? If you can come to our clinic in the U.S., so Dr. Colletti, okay, here's our schedule. He will be doing ultrasounds with me in June in Greece. That's one chance, free laser, free ultrasound. Then he's at the VBF event in October, free laser, free ultrasound. And then in December in Italy, free laser, free ultrasound. So those are your 3 chances this year to get an accurate diagnosis. Okay, I just found out there is a cause for KTS. My daughter has it and is 28. I did some reading about PIK3A, then I read about this mutation in breast cancer, and now I'm worried. I mean, I have a number that have said they've developed cancer. I don't know if it's 2 random convergences.
there is no scientific data
Okay.
behind it.
Okay, well, that's all people need
But
to know.
I mean, vascular anomalies share genetic mutations with cancer. But this doesn't mean that someone who has a vascular anomaly is at risk for cancer. For instance, someone before asked me about MAP2K1. Okay, MAP2K1 is a typical mutation of melanoma, but a person with a vascular anomaly positive for MAP2K1 has 0 increased risk of developing melanoma. So because the mutation is just in the endothelial cell of the malformation, not anywhere else in your body.
So she's talking about living, if there's anybody in Istanbul, but I think we don't know of anyone. I would say either you in Italy. I don't know. I mean,
Not
because
sure I can
we
help.
don't have anyone on our website from Istanbul. No one has come forth. So that's all I can tell you. Tiffany has a 14-month-old with a port wine on his face, cheek, upper lip, and nose. We use the numbing cream Ametop, AMETOP, probably like an EMLA, before laser. I've read that some doctors don't think you should use a numbing cream as it's another layer for the laser to penetrate. I read a research paper that Ametop doesn't inhibit the laser penetration. I wonder what your thoughts are and if you think it would be making a big difference for the pain level of her son.
Okay, so there is a paper written by Roy Geronimus, actually, I think, but I'm sure about the paper, where they were able to demonstrate that putting EMLA on the skin before treatment doesn't alter the result in any way. So it's perfectly safe to put it on and it won't affect the result. On the other hand, I would not recommend doing laser without numbing cream because it can vastly, greatly reduce the discomfort coming from the treatment. So it's better to put it on.
So they're asking for anyone in Spain, like I know of Ignacio, and then there's that other
In Spain for what?
for the PIK3CA mutation, whatever. But I mean, there's got to be. She's in Istanbul, and then the other lady is saying anybody in Spain. They're just asking us. Dr. Colletti is from Milan, Italy. They're asking that too. So Rachel, you can write to me because I do have some doctors in Spain that aren't on our website, but I have their emails, and at least they may know someone in the vascular anomalies world if you don't know of anyone. So, and then your dad from Andro, his
Hi,
patient,
he's my favorite.
Dr. Colletti knows we had epileptic attack before a few weeks. Now with new medicine, it's stopped, which is great news. Oops, sorry. I have to read them off of here because
Yeah.
they keep getting tracked. All right. If you recommend any particular Istanbul, okay, we did that. Spain, and that's Andro. Marine Kondrulik, that's your patient, correct?
Yeah.
We had an epileptic attack before a few weeks. Now with new medication, it's stopped, but we worry if laser treatment will attack it, activate it. It doesn't, according to Dr. Comey.
No, I have been talking about with this with Dr. Comey, and because it's something that it's not published, so I asked her, who's I think it's the world's most renowned expert for Sturge-Weber's,
True.
and she told us actually that it makes no difference. It does not increase the risk of developing seizures. It's the way around. Is that your baby has to be put under the proper medication before thinking to do anything else. But if that is the right medication, then there is no increased risk.
Okay. So she wrote back to you the question in Spanish. If you want to read it out loud.
Okay, Maria, can you? I don't remember,
You have
unfortunately.
to speak Spanish.
Sorry, María, no me recuerdo de tu hijo, de tu niño. Disculpa. Si me puede mostrar algo, imagen, fotografías o resonancia, algo a la mi email. Yo te voy a responder.
Yeah, and we post the email on there so she can see it. So if Scott or whoever's doing it, just put Dr. Coletti's email there and she'll be able to read it. Natia, hello, always nice to see you. My son is 10. She must be one of your patients. Natia Kortvelesi. Okay, my son is 10, has port wine on a half part. He has only a high pressure on his eyes, so that's glaucoma, but not any other problems. It means he has Sturge-Weber. Yes.
Yes.
Yes, that's
He
what she
does.
wants to know.
Actually, the coexistence of the stain and the eye disease makes it a Sturge-Weber's. There can be, Sturge-Weber syndrome can present any of the three signs. So brain involvement, skin involvement, and eye involvement in different manners. So when they are together, skin, birthmark, and eye disease, then that is definitely Sturge-Weber's.
We actually had a patient that had seizure disorder and glaucoma and no stain. Or
Exactly.
They couldn't find one. It took them like 15 doctors to get the diagnosis. So Liv said her daughter was born 2 weeks ago with large port wine on her cheek, ear, neck. How early would you recommend it?
Immediately.
And is it best
Immediately.
to get sessions before she turns 6 months? The answer is yes.
My approach, which I learned from Dr. Geronimo, actually, and from Dr. Nelson, my approach is to start treatment as early as possible. I treated the baby, started treatment when he was 10 days old. So you shouldn't wait.
Is that your youngest?
Yeah,
That's pretty good. Props.
10 days.
That's
Yeah.
awesome. Great question. Coming back to the AVM, how do you know if there's an AVM under a port wine?
It's so easy. You put an ultrasound probe, measure blood flow underneath the birthmark, If there is atypical high flow vessels, if there are those kind of vessels, that's an AVM.
So the woman who has the liver lesion with misdiagnosed as Sturge-Weber, should she get that followed once a year, or those liver lesions?
Yeah.
An MRI or just ultrasound?
Well, that is not really my field, because
Okay.
first of all, we don't know, because you're telling me that you have a liver hemangioma, but I'm not seeing the images, you know. So if it's a liver venous malformation, then yes, maybe once a year, an MRI or even an ultrasound in experienced hands, but this is the limit of ultrasound. Ultrasound is highly operator dependent. So if you want to follow it up with ultrasound, it should be the same person doing it all the times.
Makes sense. So we've caught up, even though we're quite a few people on. More questions? I did see, she said this was something the doctor also recommended following up once a year. So that makes sense. And they may stay dormant, they may grow, they may just stay the same.
Venous malformations of sporadic single venous malformations of the liver almost never require treatment.
Good news. And then for any of you who missed it, Dr. Colletti's doing a new procedure for extracranial AVMs, and we're getting very excited about that. Okay, so Sherry Thought says, my 5-month-old granddaughter was born with a large port wine on her back, down her leg, no sign of overgrowth or any other symptoms of KTS, but her derm specialist made a note to watch for Wilms disease. Is there some connection with port wine on the back and Wilms disease?
Not that I know. Definitely. Wilms.
Wilms tumor.
No, that's Wilms disease is a how do you say rame? What's that metal that you use for electric wires? Copper. So that is a disease that is linked to copper accumulation, and there is no link between port wine stains and copper accumulation.
So likely.
I'm quite surprised.
And just FYI, so all of you know this, even today, even though we've been around 29 years, even though he's one of the leading experts in the world, there's still a 65% misdiagnosis rate.
Yeah. That is true.
So went to okay, what is this about Dr. Weiner and Dr. Geronimo? I'm trying to see these questions. And what is, all right, I don't know what's happening because this just popped me somewhere else. I don't know what this is. Oh, here we go. I live in New York. Okay, I live in New York. My daughter was diagnosed with K6. She's been treated by Rosen. Can't get better than that.
Cannot.
And Weiner for port wine. Went to Geronimus too when she was a baby. Happy to help and support other parents. Well, Sabrina, then you can go to birthmark.org, click on resources, and become one of our global ambassadors.
Yeah.
And Scott will even tag to you if he's still on. He's the director of our Global Ambassador Program. And it'd be wonderful for you to share those experiences with other parents. That's what we hope for.
Sorry, I made a mistake. That was not Wilms disease, Wilson disease. So forget about what I just told you. I'm not sure what Wilms disease is.
Wilms tumor is a kidney.
No, I know what Wilms
kidney
tumor.
Yeah.
But I'm not sure she is
talking about the same thing. Okay, sorry. Tracy's talking about an AVM on the tongue. How would you go about treating that? Oh, you just did one. Perfect, right?
Yeah, I just treated a 20 years old, beautiful girl who had this AVM in a tongue, and we decided to do this new treatment protocol with interstitial ultrasound guided bleomycin, and she responded well to a point that we are now about to just do surgery to remodel the shape of the tongue. I'm not saying that these is the case in every patient, but in some, yes. So.
And you're very confident that that's going to be dormant, cured,
Oh
under
yes,
control?
there is
Yes.
no sign of residual disease whatsoever.
That's important. Just a quick one for zinc, for laser in India, go to our website at birthmark.org, and the top where it says find a doctor is a drop down outside the US. Scroll till you find India, and we've got like 6 doctors there. I don't know anything about the geography, so you'll have to look at which one's closest to you. Do port wines return later in life? How often is the laser done after initial cure? So we don't use the word cure.
No, at least not in the majority of port wine stains. So the fact is that, as many other vascular anomalies, this is a malformation that involves all the capillaries, or I should say the first venule, in that capillary bed. So if some diseased vessels are left behind untreated, which is the case 99% of patients, there is a risk of, we call it recanalization, and this is lifelong. So it is not unusual for patient to have to undergo, say, laser treatment, say, once a year to consolidate the result.
This is a very good question, and I know the answer. I hope we agree. Her baby's port wine goes down into the ear canal, and she wants to know, can it cause any hearing issues or issues?
Okay, no, it's not really hearing issues. I've seen 2 things. First, if there is thickening, then yes, there can be a reduction in the hearing of your baby. But the second and most frequent thing that I have observed is the pyogenic granulomas happening in the ear canal and in the concha. So you have to take care of that.
Yes, and I've heard of that too. And you might even have him have like infections more.
Yeah.
Or something.
If it becomes constricted.
Right.
Yeah,
If
that's
it becomes constricted. So, my daughter's goes down. Okay, we answered that. Just want to express gratitude for Dr. Linda, experts like you both, and your continued research. Families are so blessed by your work.
Thank you.
Jake's mama.
Thank you.
I thank you too. Okay, what are the chances to get glaucoma if you have a Sturge-Weber, like a stain?
That's a very good and very relevant question. So a Sturge-Weber syndrome presents a risk of developing glaucoma all lifelong. Even if you're like, say, 20 and you never had issue, you could develop glaucoma. So it is necessary to have an eye examination once a year for glaucoma, even though you have no symptoms.
Alona has a great question. Could embolization be effective for high-flow facial AVM in the fascia? And is there any risk of regrowth or recanalization after multiple embolizations? Would you be able to do surgery if another preoperative embolization is not possible?
I have to make a very long story short. I don't believe in embolization as a means to cure an AVM. Actually, let's start by saying what is an embolization. By embolization, you mean that you put something inside a vessel that occludes that vessel. Okay, this is what embolizing means. I don't like it in AVMs because you don't kill the diseased cells. You close a feeding artery, so you cause ischemia, and ischemia will in turn make the AVM worse. So you will have an immediate relief because you close the artery and you stop the blood from reaching the AVM. So in the immediate post-treatment you will feel very good. But after a few months, or maybe it will take a year in some instances, but your AVM will come back worse than it was because you triggered its growth. And very, very likely you decompensated the tissues around the AVM. And about me being able to do surgery after many embolizations, probably, but I have to see the single case.
So Luana, which is how I think your name is, or Ioana or Luana right here. If you haven't had any of that done, get a free second opinion, because this is what we're talking about as introducing the groundbreaking, cutting-edge treatment, minimal downtime, and after what we saw today,
Yeah.
pretty confident that when on ultrasound it's as dormant everywhere as you saw today, there should not be any recurrence because it's dead.
Yeah.
So this is new. If you start on that embolization train and all of that stuff, you're going to end up like the patient we saw today who had 70 procedures, where the young girl with the massive chin AVM had 2, and the disease is gone. 2 embolizations, barely any downtime, a little bit of swelling, discomfort, but
2
not...
electroscleral, not 2 embolizations.
I'm sorry, 2 new electrosclerotherapies.
Yeah.
Thank you for correcting me on that. So we got to get this out because everybody's still going the old school embolization and surgeries and so forth. Okay, so we have 14 minutes left. Again, you can go back and watch these. We keep them. Next month is our month of awareness. So we'll be needing a little video from you, congratulating and saying a little 30 seconds. Maybe I'll get it from you before you leave to the airlines. And make sure you all put on your birthmark, the red heart, raise awareness in your community, do whatever you can. You can reach out to Scott at birthmark.org. He's got a list of all kinds of projects, Zoom sessions, events, read the Buddy Booby book, all kinds of things going on in May to help us raise awareness. And next year, in 2024, we're going to have Worldwide Free Laser Day on May 15th. And I right now have 14 doctors signed up around the world. My goal is to have like 30 or 40. So, okay, so let's see. Do we have any more? Is it lead to bald head? That's the guy that was talking about, I don't know if it was AVM. What are chances to get glaucoma? So Sturge Weber.
You cannot say chances. There is no percentage you can say, but you have to be checked annually for glaucoma. If you intercept it, then that is usually no big deal. There are medications for it, and you can manage it. You just have to know it in time.
I think what he's saying is, can he get bald from the laser treatments on his head? Because he said, can you go bald?
I don't know.
And no, I mean, because Roy and Stewart both say there's either temporary or permanent alopecia. And that's why Dr. G puts Vaseline over the eyebrows.
Yeah.
Some people have...
I don't treat the hair-bearing skin for this very reason.
I mean, you know, if my opinion is if your hair is very light and you can see it, then I'd just probably shave it, get the laser, and then use some topical like minoxidil or something to reanimate it. Because Dr. G does say eventually it comes back. That's his thing. How can she make an appointment with you in Milan? Well, you email me, and I will give you his email, and you can forward it. And we do have a free clinic, December 1st, Ioana. Okay, so we have a free clinic, which means you could come and get an assessment, an evaluation. Or, I mean, you can come here and see him in October, depending on where you live. He's going to be in Greece with me in June doing this. in New York, here we have a full day on June 6th or 7th, whatever that Friday, October 6th or 7th in New York, and then in December at his clinic. But you can write to me, or she can just post giacomo.colletti@gmail.com if Scott wants to post that, or whoever's doing it, they can write to you directly and you'll forward it to Juliana to schedule them whenever. But, we do have a lot of free events where you could get like an opinion. So that's why we do them. People came here today. Would we have 8, 10 people?
Yep.
And it was so critical because one little baby, the family didn't know if it was lymphatic or venous or an hemangioma. Now they know what it is. Beautiful family. Now they know, and they're going to be in Italy. But they don't want to see you because they're vacationing. They don't want to see you as a doctor.
I understand.
Yeah. So anyways, it was beautiful because we did change a diagnosis, and then we saw that that new process is working. So to me, it was a 10 today, right? It was a 10. So we have 9 more minutes left. Let's see. Oh, thank you for posting it. His information. We can take some more questions. Jeff wants to know, do you think we will ever be able to use CRISPR gene editing for port wine stain?
I'm not sure. Maybe one day, but I don't see it in the near future.
So maybe the babies born today will have it, but maybe not the adults?
Well, I think that's the future.
Yeah.
For many diseases.
Mm-hmm.
So I don't know if we're lucky or not. There will be a lot less doctors needed in the world.
Oh,
kidding.
No.
But I think that's the future for many diseases, not for all of them.
So Nadia said, thank you very much for your answer. Is it possible that maybe some neurological problems in the future because of Sturge-Weber?
It depends on the age of the patient, because most of the neurological issues usually take place before age 2. Not that it is impossible after that the neurological condition takes place, but it is very unlikely.
Well, it's rare, but like we had in our network, which actually changed Dr. Comey's protocol. He had a port wine, and the worst of all, no matter what size, when they go up the upper eyelid and then onto the forehead, even if it's skinny, those seem to be the sleepers that in adult they've developed seizure. And I don't know, and Dr. Comey and I are speaking about it, but size doesn't matter, location does, and it's here up, lower upper eyelid and up to the forehead. Okay, so Carrie is saying her 20-year-old son hasn't had laser for over 6 years. He'd like to start again. What's the best laser to use on a previous treatment resistant? And we just had this big ASLMS guidelines meeting on treatment resistant port wines. Come to our conference in October because Dr. Geronimus is going to have the next, which is, we believe, fingers crossed, the new Candela laser. He's also testing the Derma V by Lutronic. He's got the Prima. You are not going to get a better treatment than you get at our October clinic, because there's not, I can't tell you how many experts there are that have this level of new devices.
Definitely.
I don't know anyone other than Dr. G, which is why we have everybody come in October to New York to get it from Dr. G. And you get the settings and the parameters, and sometimes you can bring it home, and then they'll start using those. That's why we do that for you guys, is have you come and get that. Okay, thank you. They posted it. They posted all the clinics. So we have 6 minutes remaining. Yes. Oh, and Jeff Bergen, get your airline ticket. You too, Scott. If you're coming for anything in December, because right now you can fly out of. I mean, all those who are going to consider going from the U.S. to Milan to see Dr. Colletti, I found it's just amazing that if you go into New York or Newark, you can get a round trip ticket to Malpensa, which is where you'd go for you, for 600 or 700, depending on how far out you book. That's a steal. That's round trip. So for those of you, trying to save money. Okay, what support is available for port wine in the UK?
You will answer that.
Yeah. So the answer is, right now, there's only one treatment center, and that's at Gosh in England, that we know of. To be honest, we have quite a few from the UK that come to our free clinic in Italy.
We do.
It's a short flight, but the treatment is... So this is the way I say it. If you use one of VBF experts, like Dr. Colletti, and really more like Dr. Giacomo, him above everyone else, his one treatment is equal to like 3 by our semi-cautious laser experts. Because I see them on a scale, like Dr. Giacomo, he sleeps port wine stains, so he knows them, so he knows which laser to use on which one. That's my opinion.
Yeah.
And he trained with Rox Anderson, who invented the pulse dye laser. They all were together. Dr. Nelson, Dr. Anderson were all the top dogs. What age range do you recommend for general anesthesia for laser in children? What age does it start to become too hard to do laser without it? At what age, when the child is older, are they able to handle it without it? To me, that's individualized.
Yeah, but I have my protocol, so I don't do general anesthesia in newborns. I treat them without general anesthesia, only some topical anesthesia. I stop treating babies at the age of 2 because that they become aware and they may remember the trauma of being held. Basically, it's not the pain, it's not really the pain, but the experience. So I stop and I start back again if needed after the age of 3 under sedation. And usually babies are able to cooperate actively after the age of 7, 8. We have Dora, remember?
Yeah, yes.
Our Dora.
Our little baby Dora. So as we wrap this up in our last couple meetings, what takeaway from this ISFA meeting, like for hope for any new... I think the thing that I'm most impressed with is the level of gene mutation identification, which will, not today or tomorrow, but someday relate to a drug therapy like alpelisib. No one knew there was going to be a drug years ago because we actually didn't call all of these conditions where there was enlargement as overgrowth. We just said KTS or lymphatic or whatever we called them. But now they're under this umbrella, meaning if there's swelling, so it can be like an enlargement, then that has typically the PIK3CA, the PROS, which is PIK3CA related overgrowth syndrome.
Yeah.
And they're creating, there's drugs that they're experimenting with, but there's also drugs that are going right into clinical trial to see how they will react. So I think there's a lot of hope for the future.
Yeah, and hope comes from the fact that, as I told you before, many of the genes that cause vascular anomalies are the same ones that cause tumors. Not that if you have a mutation in a vascular anomaly that is common to a tumor, you are at increased risk because you only have that mutation in endothelial cell. But the drugs that work for tumors also work for vascular anomalies. So this is a very good news.
So Kay, to answer your question about what that advantage would be, go ahead and you've got your appointment in a couple weeks at Gosh, and I've been told it can take 6 weeks to 6 months to get an appointment. Dr. Colletti lasers every Friday at the Laser Plus Clinic, about 15 babies. Now in London, you're going to be covered under your healthcare system. So what we have, and I don't know that you accept Europe's healthcare, or do we just do the flat fee? No. So we do a flat fee of 500 euros, which is a VBF flat fee with Dr. Colletti. So the other thing is, it is very important that you understand, even Kay, that if you get the laser treatment, their protocol may be oh, well, we'll do one every 6 months. Our protocol is one every 2 weeks, if not sooner, so you reach maximum clearance sooner, so then the baby can get back to normal and have maybe one touch-up treatment a year. When you go through GOSH, there's such a long wait in between that the stains can come back. That's the key. They're not on that tight ship schedule that we are.
I don't know about that, but
I know from what they tell me.
Yeah,
parents.
I would put it like this: try and find a doctor near you who can deal with that, and if they don't give you the answer you are looking for, feel free to come and see us.
And we have the free laser clinic
Yeah.
in December 1st in Italy. You plan it ahead of time. It's a short flight for you. You'll get a treatment. Dr. Comey, the world's leading Sturge-Weber experts, there for free. And then Dr. Delphinian's coming this December for free, and he does extremities. So it's going to be a real rocking and happening. We started with just free laser. Now we have free laser, free ultrasound, free Sturge-Weber, and free KT. And who does that in the whole world besides VBF? Do you know anyone?
Nobody.
Nobody offers these free services. This year we're going to offer glaucoma checks. Hopefully, we're working on it in pediatrics at our annual conference. So that's a wrap. I can't thank you enough.
Thank you, Linda.
We'll be doing Facebook Live again in December. So we have our twice-a-year session. And you can go back and rewatch this as many times as you want. What did he say? And you can also go to our YouTube channel, which is right on our website. Click up there, the YouTube icon. And from 2017 until today, there are over 60 videos from Geronimus and Nelson. And you can go back and listen to anyone you want. Or if you just like looking at Dr. Colletti, like so many of us do, then you can go back and look at all the ones that he's on. But they're always great. We just always have the best ones here. So a lot of you will be going to Italy, and you think it's a lot, and it's not. It's really affordable. And if he has to do any medical procedures, he's very good about negotiating and VBF fees. So thank you all. Thank you.
Thank you, Linda.
Have a
Thank you for watching.
safe trip home.
Thank you.
Thank you. See you all.
See you
Next
soon.
month is May, and we will be doing our next Facebook Live with Leslie Graff. As May is Mental Health Month of Awareness, we are doing our awareness on providing the psychosocial services for all of our families that have bullying and anxiety and so forth. So join me in May and join our international campaign to raise awareness during the month of May. Watch our page. Come back next month for Leslie to ask questions if your child or you are having any issues. And then we will see you, and we'll hopefully have you put on your birthmark to help us raise awareness. Stay safe and stay well. Take care.
Bye.